Hi, I'm Dr. Parks, and today we are answering a question from Stacy. Stacy writes that her and her husband have been trying to conceive for about 5 years, but they keep going to the doctor and getting all sorts of tests run, and all the test results come back normal. Now, Stacy wants to know if there's something that they could be missing. Stacy, I have an answer for you, and I'll be right back. Hey Stacy, infertility unfortunately is a very common issue that affects many couples every year. Now there's several causes of infertility, and without knowing your specific history and looking at your blood work, it's really hard for me to say exactly what's going on with you, but I definitely have some ideas of what it could be if all the obvious tests have been done and they come back normal. So if all your tests are normal, it means the thing that's going on and the thing that's wrong is probably something that can't be measured or seen, which makes it very difficult for doctors to make a diagnosis when there's nothing there to be measured or seen. But clearly there's an issue if you've been trying to conceive for 5 years without any success. If you haven't gotten pregnant once in 5 years and you've been, trying on purpose, then there obviously is an issue with either you or your husband. So one of the things that I like to look at, usually with women, is the history of your hormonal cycle. So if you are having regular cycles, a regular normal period is 28 days. I know it's very popular nowadays with a lot of hormonal treatments and birth control, different types of birth control, that women have different, cycles. But the truth of the matter is, in my practice, if it's not 28 days, it is not normal. There are variations of normal, but if it's varying, it's not normal. So I really use 28 days as the gold standard for most women. The only exception to that is when a woman is probably perimenopausal or in that stage of life, then the periods can be irregular. But anything outside of 28 days, I generally classify that as an irregular cycle. So that's one of the first things you need to look at. Are you having regular cycles? So if your cycle starts every 28 days, and you count that from the first day of the first spot on the first day. So it's not the first day you start bleeding, but the day you see a first spot, that's day one of your cycle. And so you need to count 5 days. So your cycle should go on for about 5 days, give or take. But it should be about 5 days. It shouldn't be shorter or it shouldn't be longer. Any variation in that is a hint that there's something going on in your hormones. I can pretty confidently say that if you haven't gotten pregnant after trying for 5 years, odds are you don't ovulate. So if you don't have a regular hormonal cycle, you're not ovulating. And if you do ovulate, it might be sporadic or not when you're supposed to ovulate. One of the things that is pretty misleading is those over-the-counter ovulation kits. A lot of women will take those tests, and they're pretty accurate in telling you when you should be ovulating, but the truth is it doesn't tell you if you're ovulating or not. It just measures a hormone that stimulates ovulation, but it doesn't actually tell you if that ovulation or if that stimulation worked. So your test might look like, oh, you're having the right, stimulation, but there's no egg coming out, so you're not actually ovulating. And I see this in my practice a lot. Like, there's so many women who have a positive ovulation test because their brain is working, their bodies are working, but the actual action of them ovulating just does not happen. So that's most likely what would be going on from a hormonal cycle standpoint. Is you're not really ovulating. Your body's kind of going through the motions, but it's not happening. There are lots of other hormonal issues that could be contributing as well. But when you don't ovulate, it usually results in a situation that we call PCOS, which means that your ovaries have little cysts on them. It stands for polycystic ovarian syndrome. And the cyst actually represents eggs that try to come to the surface of your ovary so it can get out of your ovary, but it doesn't actually move from the surface, so it gets trapped and it forms a little cyst every month. So some women can have multiple cysts on their ovaries, which represent, you know, ovulations that just didn't happen. This condition leads to irregular periods, and some people have perfectly normal periods, but they don't ovulate. And that's a kind of a different situation as well. Estrogen dominance is where you have a lot more estrogen than you need. And one of the easiest ways for me to tell if a woman is estrogen dominant is to look at her. If you have very large breasts or larger hips, that usually is a sign of estrogen dominance, just because estrogen grows things, and your hips and your breasts are very estrogen sensitive. But that's not the only sign. Some women can be very slender, very thin, have really small breasts and hips, and be extremely estrogen dominant. So that looking at a woman isn't always a telltale sign, but that it could be. So really, I would need to know a lot more, but I have a handout that I have prepared that you can go to my website and download. It's drparks.com/conceive, and that handout will walk you through some of the things to look for that could be contributing to the infertility that you're experiencing. So if you go through that handout, it will give you a few more clues and then some instructions on how to possibly go about correcting all of this. Now remember, when you have health questions, ask Dr. Parks.